Mr. Chairman and committee members, my name is Shannon Thompson and I'm here on behalf of Educate Advocate. I want to extend our appreciation for granting us ample time to address the data provided in our fiscal report. The members have all been provided with an electronic and a physical copy of the appropriations report prepared by Educate Advocate, and I refer you to this report for additional detail regarding the fiscal impact of SB 276. As a nonprofit organization serving students and families with exceptional needs, we urge you to move this bill to suspense today and vote that it remain in suspense when it comes to your attention later this week. SB 276 purports to provide a solution to the apparent increase in medical exemptions and current measles outbreak by abrogating a physician's discretion to issue medical exemptions, instead entrusting a public health officer to ascertain eligibility by comparing a standardized request form against narrowly construed CDC contraindications and precautions, a process void of any physical exam or medical record review of the patient. In our analysis of the fiscal impact SB 276 imparts on the state of California, we must determine the cogency of the broad points at issue and measure the financial exposure relative to commensurate benefit. The bill proposes exorbitant solutions, including a medical exemption database, which requires a varied landscape of end users from schools to physicians and public health officers, as well as retention of medical records, which contain personally identifiable health information of patients and students. Thus, it imparts a complex and costly layer of legal requirements to ensure adherence to HIPAA, FERPA, the California Confidentiality of Medical Information Act, as well as various civil rights and education laws such as the ADA, California Civil Rights Act, the Federal IDEA, and the Rehabilitation Act of 1973. We estimate the immediate cost of the database to be $9 million annually. This initial cost of creation, implementation, maintenance, retention of personal health records and personnel, as well as an unknown cost attributed to CDPH attorneys promulgating regulations and appeals. Of additional importance is the unknown cost to our local school districts to the extent that student enrollment continues to decline and litigation based on patient and student confidentiality and discrimination are successfully brought forth. These cases can cost districts in upwards of $15,000 to $150,000 per case, which can include compensatory damages and attorney's fees. In restricting the criteria of medical exemptions, we can anticipate a percentage of students who will be excluded from attendance, thus impacting the average daily attendance revenue to the upwards of $439 million in the first year. This is a decrease in funds that our local control funding formula cannot compensate for. We are already grappling with year after year decline in enrollment, putting downward pressure on Proposition 98's minimum guarantee. Indeed, we can look to Sacramento City Unified School District as an example of the poor fiscal health and declining enrollment of our public schools, as Senator Pan has noted in his April 10th mailing, indicating that the district is at immediate risk of state takeover. Governor Newsom's January budget proposal recommends a 15% diversion of health realignment funding to support his initiatives, which translates to a 50% cut in realignment support to public health for some counties, including Sacramento. The Department of Public Health's general fund decreased 4% in the last year and saw excess cuts to local assistance programs in the upwards of 77%. As Senator Pan highlights the cost associated with treating adults acquiring measles, 33 of the current 44 infections in California are adults aged 18 years and older. We are implored to compare the current outbreak costs and budgetary decline relative to fiscal requirements of SB 276 on the Department of Public Health. Since 2016, there have been 153 investigations into physicians potentially writing medical exemptions, resulting in a single disciplinary action not related to medical exemptions, but a personal opinion letter written by a physician for a patient involved in a custody dispute. We cannot continue to allow the red herring of fraudulent exemptions to exert financial pressure on our state medical board resources. I urge the committee to consider the extensive financial implication of SB 276 to our state departments and public schools and move to prohibit SB 276 from becoming the Rubicon for costly public health policy. I ask this on behalf of the less than 1% of all California students who have medical exemptions, many of whom are on delayed immunization schedules, have positive serological titer results conferring immunity, and temporary exemptions from live virus vaccines such as the MMR due to immunosuppressive medication or treatments. In closing, I respectfully ask that you move this exorbitant bill to suspense today, and that when it comes before you later this week, you again vote to retain it in the suspense file. Thank you.
3 minutes left.
Thank you.
Thank you, Senator Portantino and other members of the Appropriations Committee. The Appropriations Committee. My name is Christina Hildebrand. I'm here on behalf of A Voice for Choice Advocacy. We agree with all that Ms. Thompson just stated regarding SB 276. This bill will have a large, unnecessary, and ongoing impact on the California General Fund. We've provided each of you in the committee our report. A Voice for Choice Advocacy estimates the cost of SB 276 in excess of $40 million in the first year and in excess of $32 million in each subsequent year, with an additional approximately $650 million potential loss in school ADA and/or millions, if not billions, in potential healthcare costs. This is all to deal with a very small number but unknown number of fake medical exemptions. It does not make fiscal sense to spend nearly $100 million of the California General Fund annually on this bill to go after an extremely small number of physicians when the California Medical Board has the tools to do so, and in doing so, undermining the doctor-patient relationship for nearly 140,000 physicians in this state. Another stated goal of this bill is to reduce the pockets where herd immunity or community immunity is not reached in certain schools, that is, where vaccinations do not reach 95%. This bill will not address that, as the majority of schools that fall below 95% don't do so because of medical exemptions, but because children are overdue with their vaccinations or conditionally entered. In other words, they're getting vaccinated. Approximately 20% of the medical exemptions are either temporary because of positive titers or immune suppressive treatments, and therefore this bill does not address that, and the fiscal impact is huge for an even smaller number of medical exemptions. A few other areas which are of concern to us, which Ms. Thompson did not touch on, include the unknown but high costs of the appeals process. Another area includes the cost of outreach to physicians, schools, and other interested parties. And finally, as we mentioned in our fiscal analysis of the bill, CDPH will need to acquire liability insurance or establish some form of compensation fund for any vaccine injury resulting in their denying a medical exemption. Neither the vaccine manufacturers nor those administering vaccines are liable for vaccine injury under the 1986 Children's Vaccine Injury Compensation Act. However, if CDPH denies a medical exemption and subsequently that child is vaccinated in order to attend school and suffers from a severe adverse reaction, the parents could sue CDPH for a vaccine injury due to forced vaccination. The measles outbreaks in recent years, including those happening currently in California, have only been in 25% of school-aged children. This bill would not impact the measles epidemic or the fiscal piece of the measles epidemic because it's not being transmitted in school. In the Disneyland 2015, there were 24 school-aged children and none of them were transmitted in school.
That's your 8-minute mark.
Okay, can I just finish up? Yeah. A Voice for Choice Advocacy feels this bill is unnecessary, and we ask that you respectfully move this costly bill to suspense today, and when it comes for a vote later in the week, please keep it in suspense. Thank you.
Thank you.